plus proving factory surcharge or delivery fee. See website for details.
All right, 25 minutes before 10 o'clock. Thank you for tuning in. We read the news a lot on radio. We do it every day. And I can't think of a better story to read to you than one that starts this way. By reprogramming a 7-year-old girl's own immune cells to attack an aggressive form of childhood leukemia, pediatric oncologists at the Children's Hospital of Philadelphia have achieved a complete response in their patient who faced grim prospects when she relapsed after conventional treatment. We are, I bet, getting close to finding a cure for all cancers. That one sentence right there is such a positive, encouraging statement that, you know what, it's amazing that some people in the world are hell-bent on just killing people, and then 99% of us are really good, and 1% of us have this really amazing ability to figure out what's going wrong and how we can fix it, at least medically speaking. Dr. Ann Reilly is on the phone. She is the medical director at the Cancer Center at the Children's Hospital of Philadelphia, the one I just referred to. And she wants to talk to us about the cutting-edge treatment called T-cell therapy. Let's find out what it is and how it might affect us one day if it's not already. Dr. Reilly, good morning, doctor.
Good morning.
Thank you for being on the air with us. Are you in Philadelphia right now?
I am.
Did you know the little girl that I was reading about?
Yes, I did. She's a wonderful kid, and she continues to be a wonderful kid.
Wow. How long ago was that story?
Oh, my goodness. We treated her 2.5 years ago. She was the first child to get this new form of therapy called T-cell therapy, and we've treated, I think, maybe another 30 children since then. We're really excited about it.
Does it always work?
Doesn't always work.
No.
About 90% of the time we get an initial response, and about 3/4 of the time it works. So, and you know, these are children for whom the regular therapies haven't worked. So these are kids who have already relapsed on regular therapy. Regular
therapies would be chemo and radiation?
Yeah, mostly chemotherapy, sometimes radiation.
What does the T stand for?
T is for the T lymphocyte. So lots of different kinds of white blood cells in the body, lots of different kinds of lymphocytes, which are a type of white cell, and T lymphocytes are a type of white blood cell, a type of lymphocyte that fight sort of invaders, help the body fight off invaders.
Wow. Do you think
we do?
Oh, I'm sorry. Go ahead.
No, I was going to say what they do in the lab is they take those cells out of the children and they engineer them to fight the leukemia, and they give them back, and then the cells don't recognize the leukemia anymore, you know, as they recognize the leukemia as an invader, and they fight it.
How did they ever figure this out? Were you part of the group that figured it out?
Well, I'm a clinician, so I help take care of the children, but the laboratory researchers, Dr. Stephen Grupp and Dr. Carl June, the ones who actually figured out how to engineer those cells and make them live inside the child and kill the leukemia, I mean, it just takes years of research and hard work to be able to do that.
Is this T-cell therapy known in other parts of the country? We have a young lady in our church that has been battling leukemia for almost 2 years, and this would be something wonderful for her to try.
I think, you know, researchers all over the country have been trying to do this for a while, and some are, you know, there are different ways of engineering the T-cell, and some are more successful than others. You know, we've been very lucky that our researchers have figured out a way to make it work and to make the T-cells last for a long time. And we do get children from all over the country who come here to get this treatment.
Oh, so they need to come to you then for this?
Yeah, because our laboratories here that do the T-cell engineering are very specific in the way they do it.
Wow. Are you receiving children from all over the world?
Well, at least all over the country, and some from other places. Yeah, I mean, it's, you know, obviously it's a beginning thing. We're treating small numbers of children right now. We're really hoping that if this takes off and is as successful as it looks, that we'll be able to treat more and more children, and that the treatment will spread around the country.
Wow, you know, I mean, we celebrate the wrong people. We celebrate rock stars and football heroes, and nothing wrong with those folks. But Dr. Ann Reilly and the researchers you mentioned earlier, they should be household names. Mm-hmm. You know, it's just not the way we work here. But anyway, so tell us if the radio tour, the fact that you're on the radio with us right now, is to educate us? Is it to give us hope? Is it to educate the doctors who might be listening?
Well, we want to spread the word in general. September is Childhood Cancer Awareness Month. I don't think people are aware that over 15,000 kids a year in the U.S. are diagnosed with cancer. And I think that we don't think about children having cancer as much, but the research is really important to pushing us forward. And we cure about 85% of the kids, and that's really great, but we want to cure 100%. That takes research, and to be honest, the research takes money. And so we want people to be aware that these kids are out there, they're in our communities. We need to support them and their families, and we need to support the research that is sort of going to make the cures possible for them.
When you use the word children, does that accommodate every child from 18 and younger?
Yeah, actually, we treat kids up to actually 18, and then our adolescent and young adults. We have a program here at Children's Hospital of Philadelphia that will treat young people into their early 20s, actually.
Do you know the one thing I don't understand about cancer, and I think it's been explained to me, but it always goes over my head, is that the way you treat breast cancer is not the same way as you treat other cancers, and lung cancer is different. They're all different animals, in a layperson's way of saying it, right?
Yeah, in some ways they're the same, because cancer is basically a growth that grows out of control and takes over a normal part of your body. But each cancer has a different way of growing and a different pathway that it grows, and that's why each cancer has to be killed a little bit differently.
Have we as a society, have doctors, researchers found a way to cure any of the different types of cancer? Is there any cancer that's been cured?
Well, we definitely cure lots of people who have cancer, but there are very few cancers that we cure everybody that has it. So, for example, in leukemia, we cure about 85% of the children who have leukemia, and those kids grow up and are cured, but there's about 15% that just have these hard-to-treat leukemias that we can't cure, and that happens in most kinds of cancer.
Now, leukemia, again, I don't really understand it. It's a cancer of the blood. Are there actually tumors involved with leukemia?
Well, it's a cancer of the blood, and so your blood is actually made in your bone marrow, that sort of soft, squishy part inside the bones, and so it infiltrates in that area, and then anywhere that blood cells congregate in your body, so like lymph glands or some of the organs, like your liver or spleen, can swell up when you have leukemia. So it does sometimes make lumps in that way.
I gotcha, yeah.
When new children come into the hospital for treatment, are there the quote-unquote seasoned children that have had treatments for a while? Do they become the ambassadors to the new patients so the new patients won't be too afraid?
Yeah, it's amazing what our kids do. They bounce back and they help other kids in an incredible way. It's really sometimes just very inspiring to watch how much our kids are willing to give even while they are so sick themselves.
The fact that you're willing to spend some time with your busy and important life is so wonderful that you're able to come on the air with us today, Doctor. Our listeners have been calling. Do you want to take a call? Are you okay with taking listeners' calls?
Absolutely.
Okay. I just want to make sure. Good morning. Thank you for calling and for waiting. You're on the air with Dr. Ann Reilly.
Good morning, Dr. Reilly. I support the St. Jude's Hospital, and some of the children that we see are, and the stories you read about are heart-wrenching. I was just curious, does this T-cell procedure work with adults? And I'll hang up and listen to your answer. Thank you.
Thank you for the call.
For what you do.
Absolutely. That's a great question. Yes, we've actually had here at the University of Pennsylvania, which is right next to the Children's Hospital of Philadelphia, a number of adults with leukemia who have also been treated with this T-cell therapy. The research that we're doing here is actually a joint effort between the University of Pennsylvania and Children's Hospital, and so a large number of adults with this kind of leukemia have also been treated with this T-cell treatment.
This is good news. I'm hoping that maybe a year from now we have even better news about cancer in general and about this children with cancer. It's I don't know. There's something about that just seems like we need to eradicate that.
Oh yes.
Doctor, thank you for being on the air with us today. I want to make sure that our listeners have the information they need to look into this further, because if they call me, you know what's going to happen. I'm going to say, I don't know. So do you have a website we can send them to?
Absolutely. Cancer2014.chop.edu. Lots of information about our treatments and our children.
Wow. Okay. Well, thank you so much for being on the air with us. And definitely come back if there's any updates or just if you want to come back. All right?
Absolutely. Thank you so much.
Thank you. Great interview. All right. We'll take a little break and we'll be right back.
Hi, Danny Werfel here. Get moving with Florida Credit Union's fast and easy loan approval process.
Let Florida Credit Union start up a new car loan for you today. No more waiting, hassles, or stop signs. You can even apply online.